Hello, good morning, Instagram family. It has been such an incredible week. If you were watching Morning Express this week, I was in for Robin and I was joined by Dr. Perry Wilson of the Yale School of Medicine. And we just were in awe of this monumental moment in modern medicine, that we have a vaccine less than a year from when this pandemic has begun. So inspired by some of his information. I really wanted him to come on All Good Things and answer some of the big questions that we all have when it comes to this vaccine. Dr. Wilson, it's so good to have you. Thanks for being with me.
Hi, it's my pleasure.
First, I just want to get your reaction. I know both you and I witnessing history on Monday. It was just phenomenal. I had a hard time putting it into words. What's it like for you to witness the first healthcare workers getting this vaccine less than a year since the pandemic began?
It was so awesome. I mean, it's what a triumph, right? The last fastest vaccine we had was mumps, and it took 4 years. And so this is really like blowing it out of the water. Now, we have to say this is because there's been, decades of research in basic science and investment in the technologies that could produce this vaccine. So it's not like, some genius came up with this just this year. But it really was amazing to see how fast it turned around. And as I said to you, I was so glad to see it happen in New York first. It was just not, that was where, the virus was just so devastating. And I have a number of friends who work in healthcare in New York. I went to medical school at Columbia in New York, so I still have a lot of contacts there, and they went through so much that you don't even hear about all the time. And it was so great to see them start to get it. It's really exciting.
Yeah, I was so moved just thinking about the human spirit and everything that these healthcare workers have given to us during this time. They have worked around the clock. They've put their lives on the line. So for me, just to witness it outside of the medical community, it was just like, this is what we needed in 2020. We needed to see that we are capable of overcoming something really challenging. I want to tell the folks that are chiming in already, they're saying, thank you, Dr. Wilson, for all of the I appreciate. Well, I have found every time that I interview you, I just get a wealth of information. And I wanted to have you on because there are a lot of questions surrounding this vaccine. And it's wonderful and it's great, but there are a lot of things people need to know. First and foremost, there are a lot of concerns. And I encourage the viewers to chime in, asking comments, any questions, and I'll get to them. But my first question is, there are a lot of sort of fears around how quickly this came to be, and whether or not there's the data to prove that this is in fact safe. What do you say to that?
Yeah, so a number of things. So it was quick, but not quick in the way I think people generally think. This didn't come out of nowhere, as I mentioned. So the technology that people seem to be worried about are these mRNA vaccines, the Pfizer and Moderna vaccines, which are coming out first. That platform, that technology using mRNA to make vaccines has been studied for 15, 16, 17 years already. So we have a lot of data to suggest that they're safe. No, we didn't have the coronavirus 15 years ago, but basically they're using the same technology, but replacing that mRNA code at the center of it. This reminds me a little bit of how the flu vaccine works. It's a different flu vaccine every year, right? You replace part of it. The technology is the same. The thing sort of surrounding it is the same, but we replace the ingredient in the flu vaccine that's going to engender the immunity. But we know it's going to be safe because we have all that previous data. So before we even started these trials, there was a lot of data to suggest that an mRNA vaccine would be safe. But that's not enough for the FDA, and it's not enough for me either, right? You have to say, is this one really safe? The other thing to remember with vaccines is that the vast majority of side effects happen within minutes to weeks of vaccination. Months is even on the outside of when we see serious side effects. So FDA wanted at least 2 months of follow-up in these patients to see if anything would crop up. And as you've reported, and as many people have pointed out, the incidence of serious side effects was very, very rare, on a par with what you see with any other vaccine, with flu vaccine and things like that. Mild side effects, they're there, right? Fever, muscle aches, fatigue. These vaccines do seem to give you some of that for about a day, but that's way better than coronavirus, certainly, and is nothing that people are unable to handle. We do need to monitor for long-term effects, but you really aren't going to see rare, unusual things in these trials, even in trials of 50,000 people. Because if there's something that happens in 1 in a million people, you're not going to know with 50,000, right? And so what the government has is a program called the Vaccine Surveillance System, which basically says any adverse reaction to a vaccine or that a physician thinks could even be due to a vaccine gets reported into a database. And so as we roll out the vaccination, any weird stuff that happens is going to go into that database for analysis. Now, there's going to be weird stuff. I pointed this out in an article I wrote for Vox. You know, if you vaccinate 1 million people, someone's going to get in a car accident on their way home from the vaccination, right? We know that someone's going to have a heart attack the next day. That's just statistics. So we don't want to get too scared when these reports, one-offs, come out. We just want to pay attention and start looking for patterns.
I'm glad you brought that up, because just this morning there was the breaking news that there was a second healthcare worker that had an allergic reaction. Okay, so you make a really important point in that, listen, the news is going to report every single thing that comes out, but it is important to put into context. When my son gets his vaccines early on, they say, listen, he might get a fever, he might feel sick, he might be really sleepy. This is what vaccines are. This is the side effects.
Yes.
So when it comes to allergic reactions, I want to get some information on ahead of the vaccine coming out. They said specifically, if you have an allergic reaction, reconsider possibly taking the vaccine. What are we talking here when it comes to allergic reaction? Like, is it shellfish or allergic reaction, peanuts? I mean,
yeah. I know the guidance on this, to be honest, is not great yet, and I think people are still sort of finding their way here. So a bit about the allergic reactions that have happened. The majority of them, I think there have been 4 or 5 so far reported, were in people with pre-existing allergic conditions, but none of them, to my knowledge, were allergic to a specific substance in the vaccine, like one of the chemicals that preserves the vaccine or anything like that. So it's not as simple as like with the flu vaccine, which comes from eggs. You know, oh, if you have an egg allergy, you shouldn't get this flu vaccine. Right now, they're just saying that the federal guidelines say if you have a history of allergic reaction, that you should be monitored for 30 minutes after taking the vaccine. That doesn't mean necessarily monitored by your doctor sitting there in the office, but you know, someone should have their eye on you. They also are saying now for the beginning, and this is likely to change, that even if you don't have a history of allergy, someone should have their eye on you for about 15 minutes after the vaccine. And that's just out of an abundance of caution to make sure, because these are new. The rate of anaphylaxis, which is that like really severe allergic reaction that is what scares all of us, is about 1 to 2 per million with all vaccines. So we're going to see this again. We're going to see some people have anaphylaxis. Is it going to be higher with this vaccine? It's too soon to tell, really. We don't actually know. I mean, we know that 2.9 million doses of the vaccine has been distributed around the United States. We don't actually know how many have actually gone into people's arms yet. So it's a little hard to know what our rate of anaphylaxis is. We're going to see it. But for the vast majority of people, you're going to be fine. And this is something, we'll see a couple of cases, but I'll point out that none of these people who developed a severe allergic reaction to the vaccine they're all fine. They had to go under observation in a hospital for a day or so, and then they got out and they're fine.
So if you have any type of allergic reaction, you should just be monitored for about 30 minutes. Okay, that's
correct.
We have a question here from Vino. Hi, Vino. It's good to see you. He says, what's your advice to skeptics? Vaccines are good, but we must still take personal responsibilities to take our own safety measures. What's your take on if people are really skeptical? I know I had a friend say to me, listen, I'm just going to let everybody else take the vaccine and see what happens. Well, the problem is if everybody does that, we're not going to have vaccinated for herd immunity, which is about 70% of the population is what we need, 70 to 75%.
Yeah. I mean, this is a real challenge, and we have trouble, even with a vaccine like flu vaccine that we're all kind of familiar with and more comfortable with. We do pretty well with kids getting their flu vaccine, but adults in their middle ages, people my age, about 40 to 50% get vaccinated every year. So that's not 70%, and that's with the good old-fashioned flu vaccine that we're all comfortable with. So I'm really worried about this. I think there's 2 things we can do. Number one, we just have to be really transparent. We have to say, here is the data. This person had an anaphylactic reaction. We're going to follow everyone to see who else has severe allergic reactions to the vaccine. The other thing is that I think we need to use the power of social media for good for once, right? So people respond well when they see others in their peer group engaging in an activity. And so if you're the type of person who says, you know what, this pandemic is like nothing I've ever seen in my life, I want to do my part to beat it, and I know that part of that is getting that vaccine, I encourage people, show off, right? Take your selfie when you're getting the vaccine, put it on Instagram, put it on Twitter, put it on Facebook. Let your friends know that it was fine and you're doing fine. Or let them know that you had a fever the next day and you had to take a day off of work. That's fine. Let's be transparent and let people know what they're in for. That's the best we can do. And I'm happy to have the opportunity here to answer questions and tell the truth about what we know and what we don't know.
Yeah, but as you point out, it's a lot better than getting COVID. Bobby has a question here. He says, I have asthma. Is there any danger of me or anybody else taking this new vaccine if they have that condition? Which I think is a great question.
It's a great question. No evidence of that. In fact, the Moderna vaccine report that came out to FDA, they're reviewing it today. That report was released, and they specifically recruited people with airway diseases into that study and even break down efficacy by people with pre-existing airway diseases. And it looks just as effective in people with airway diseases as people without airway diseases. So that's good news. Doesn't seem to be an increased risk of adverse events there. If your asthma is the allergic type of asthma, if you're triggered by pollen or other allergens, dust triggers your asthma, so you've got kind of an allergic variant of asthma, be aware of that. Again, the recommendation, have someone keep eyes on you for about 30 minutes.
What about the safety when it comes to children and pregnant women, since that hasn't been studied yet?
Yeah, we don't know. So FDA approved the Pfizer vaccine for kids 16 and over. So it is not approved for children yet on the basis of the fact that there weren't children in the studies. The Moderna vaccine only enrolled 18 and up, so I don't expect we'll see approval for children for that one either. So for kids, there's no vaccine for them yet. The good news about that, though, is that as you probably know, coronavirus in children tends to be much more mild. And so while we will need to get them vaccinated to help end the pandemic, not getting them vaccinated first is probably okay. And I think what we'll see is we'll just sort of, we'll kind of be lowering the age bit by bit and watching to see what happens. I don't think there's a real reason to worry that kids are going to react differently, but you've got to always be careful, and we always take special care of our children.
Well, no. We've been really grateful that we haven't seen a lot of terrible cases in children.
Yeah.
It's been really asymmetric.
Yeah. It was something we were all, I remember early on, someone brought up, in February, can you imagine if it was flipped, if the outcomes that we had seen in older adults were seen in kids instead? And I was on a thread with a bunch of my, doctor friends, and we were like, could you go to work then, right? We have young kids at home, like it would be a totally different thing. So I am thankful for that. I've been asked a lot about pregnancy. So women who are pregnant were excluded from these trials. But some women did become pregnant during the trials. I think 23 or so women in the Pfizer trial and 17 or so women in the Moderna trial. Small number. Equal numbers got pregnant in the vaccine and placebo group, so that there doesn't seem to be an effect on pregnancy. And then in terms of the outcomes, they really didn't give us much. Moderna told us that there was one spontaneous abortion and one elective abortion. That's a miscarriage, and then one abortion, but both in the placebo arm. So, it's too soon to tell. That said, the recommendations are that pregnant women discuss the risks and benefits with their doctor so they can get this vaccine. And I will say that pregnancy is a risk factor for COVID-19. Women who become pregnant tend to be young, but the outcomes are worse, and worse for the mothers and the babies. We've seen that a lot throughout this pandemic. And so, talk to your doctor, talk to your obstetrician about it, but do consider getting vaccinated even if you're pregnant.
I'm doing a story on Morning Express tomorrow about how a lot of women are opting to freeze their eggs because really uncertain of what the vaccine does in pregnant women, and they want to ensure that they're not going to lose those years.
Interesting. Wow.
interesting. I talked to a patient. People should tune in tomorrow and take a look at that. When it comes to the efficacy of Moderna versus Pfizer, I had a interesting conversation with someone in the healthcare industry that they said, I'm not taking the Pfizer one, I'm taking the Moderna one. And I was like, well, what's the difference between the two? And they said, well, the Pfizer one, you have to take 2 doses. I mean, it was all very concerning to me of like, wait, I thought they were the same.
Yeah. They're pretty darn similar. They're both 2-dose vaccines, so you don't buy yourself much there. And they're both right around 95% efficacy, which, as I've mentioned to you, is just like a crazy high efficacy number. Seasonal flu vaccine ranges from like 40 to 60, maybe 70% efficacy on a good year in terms of protecting people against flu. So these are both slam dunk, like blow it out of the park vaccines. So no, my advice, like whatever comes to your area first, whatever your doctor can get you or your workplace can get you, just that's the one to go for.
Okay, that's really good to know. My parents actually are going through COVID right now. They've both got it. They are doing well. They're pushing through it, but they asked me, do I need to get the vaccine? They're 76, so they're in the risk factor, but do they need to get it if they've already had COVID? And how long do they wait until they get it?
Right. So the recommendations now are not to get it while you're sick with COVID. I think just because we don't know exactly what's going to happen there. But once you're recovered, which means, you don't have symptoms anymore, and it's been, the CDC has reduced this a little bit, it's been at least 10 days since you, first knew you were infected. So once you're out of the woods in terms of COVID, the current recommendation is that these people can get vaccinated, and it's probably a good idea. The reason being that we know, that reinfections do happen. They're pretty rare, but reinfections do happen, and they can even be worse than the first infection, particularly if the first infection was mild. So that's something to think about if they're having a good run of COVID, and I'm sorry to hear that they're infected at all. The second thing to remember is that the vaccines actually boost antibody levels higher than native infection, which was an early finding that came out even before these big trials. So these vaccines are really good, and I think we should have people get vaccinated even if they've had COVID in the past.
I want to ask this question by Mike, and I ask this question because I think there are a lot of people that might feel this way when it comes to, and I want you to fact check the survival rate when it comes to COVID. He says taking a vaccine that doesn't stop the spread of COVID or stop you from getting it without knowing any ingredients in it for a virus with a 99.7% survival rate is asinine. And it's a challenge, but it's an important point to address because there are going to be people who feel like, listen, that we don't feel like the death rate is worth getting a vaccine. What do you say?
Okay, well, so there's a lot to parse there. So a number of things. Number one, we do know all the ingredients. They're all listed in the FDA documents. And yeah, there's some chemical names and stuff, but you can look them up. These are things that have been used in products in humans in the past, and we're not concerned about them being, cancer causing or anything like that. So that's there. The other thing about, in terms about the overall mortality for COVID, well, it varies, right? It varies depending on your risk factors. Particularly for people who are older, the infection fatality rate can be 10%, 20%, in the very old, even higher. Death is also not the only thing that COVID does. Hospitalization can be bad, and we know now that people are having long-term effects of COVID. Not just even in their lungs. There's some concerning data about COVID affecting people neurologically in the long term. There are people who have lost their sense of smell and still haven't regained it, which can be a real quality of life issue if you can imagine going forward through life like that. So there's a lot of bad stuff that can happen with COVID. The other thing to remember about vaccination is you're not just doing it for yourself. You are getting vaccinated to prevent spread to those people who will die if they get COVID. So, I'm 41. I don't have any medical conditions that are high risk, except I'm a healthcare worker. So my risk of contracting COVID is about 7 or 8 times higher than the general population, but that's okay. I don't think I am going to die if I get COVID. There's a chance I will. And all of us have seen young, healthy people die of COVID. Ask a healthcare worker. We've all seen it. But to be fair, I probably will be fine. I'm not getting vaccinated for me. I'm getting vaccinated for my parents. I'm getting vaccinated for my elderly neighbors. I'm getting vaccinated for the people at the restaurant that I don't know. So this is one of those times when we have to not only think about ourselves, we need to come together as Americans, think about each other, and look outward a little bit, because we all want to go back to normal, and this is the path to normal.
Dr. Wilson, you have such good information and such good logic. Also, someone pointed out that you only look like you're 31, not 41. So
oh, thank you. Much appreciated.
When do you get the vaccine?
When do I personally? So I work at Yale New Haven Hospital here in New Haven, and they started vaccinating people on Tuesday. And I'm on the list, but they're going alphabetically by last name. So Wilson is, I think they got maybe to the B's or something. So a couple more weeks for me.
Right? Like you're always the one last in line.
Yep.
When it comes to mask wearing, other ways to stop the spread, you know, we know that this has an efficacy rate, not of 100%, although it's really darn close. There are still things that we need to do to stop the spread of COVID. It's a highly contagious virus. How long will we be in the world where we wear masks everywhere and we socially distance, do you think?
It's going to be a while. We need to just get that out there for a couple of reasons. Number one, we know that the vaccine prevents the vast majority of symptomatic COVID infections. We don't yet know if it prevents asymptomatic COVID infections. And so, like, the worst case scenario would be, sure, it protects you, you're not going to get sick, but you can still spread it to other people. And if you then take your mask off and you're like, hey, I got vaccinated, all of a sudden you're the super spreader, right? That's the worst case scenario. Most of us don't think that's the case. When we get the data, we imagine that it will reduce asymptomatic infections as well. Those are being looked at as part of these trials. They just haven't released that information yet. So for now, we want, keep wearing masks, keep doing social distancing. And that's going to end really when the epidemic curve starts to come down. When enough people are vaccinated that we see the cases dropping and, the hospitalizations dropping and the deaths dropping. And we know that the community spread has dropped below a level that we feel pretty safe. So it's going to be a while even after you get vaccinated. And I do want to say, if you're one of the people who's lucky enough to get vaccinated in the next month or two before we know about the issues of asymptomatic spread, you just got to keep wearing a mask. But it's good, right? Then, everyone's wearing a mask together and no one feels like left out or special or something.
Exactly. It's the reality of our times right now. It's a small thing that we can do for our fellow Americans. It's wearing a mask. It's not doing anything really that's that challenging.
Yeah.
When it comes to some of the facts and fictions that are out there of sort of vaccination versus not vaccination, how hard is it for you as a healthcare worker to just cut through the noise? You've got those people that are no matter what, they're going to have their views. It's politicized in a lot of cases. I mean, what is your message to those who are just so determined to make this about something different than a pandemic?
This is really hard. There's been a crisis of sort of trust in science and even in expertise in general, I think, for longer than the current administration, which I do think has exacerbated it to some extent. But it's probably been going on for decades. And I'm acutely aware that, some Yale medicine professor, telling you that you should get vaccinated may not carry much weight with some people who have a worldview that, we're in the pocket of big pharma or something like that. I want to point out that all of my research funding comes from the National Institutes of Health, which is not big pharma, but there is that perception. My hope is that we can start to eat in from the edges through social networks. So the hardcore people who are like, the vaccine has microchips in it that's going to track your movement, they're at the center. They're not listening to me right now. But they do have a social network. And although we tend to be in bubbles, there are people who are on the edges of our bubbles. And there are people who are on the edges of those people's bubbles. And if we work together and we just tell the truth and say, here's what we know about the vaccine, here's what we don't know, and we let that percolate in, I think we can get further and further, because the the number one thing that can change someone's mind is if someone they trust, a friend, a family member, says, you know what, I'm going to do this. Because then it's real. It's not, it's not a boogeyman. It's not some so-called expert from an ivory tower. It's your friend, it's your neighbor, and maybe it's just enough to start thinking about it. And I hope we can get there together. I do, but we'll see.
And, I've had a lot of encounters with those who have strong feelings about vaccines in covering even before COVID happened. And the allegations of the deaths and the payouts to families. And I just want to point out there is something called a vaccine tax that people may not understand. It goes to basically a court that's put into place to avoid sort of like big lawsuits that are frivolous, like I have a sore on my arm. And there's a lot of research that I encourage people to do on their own. We can't sort of dive into every single thing, but I would really encourage people, if they have concerns, to really do their research, because it's out there, and it's so important that we get the best information to people as possible. Dr. Wilson,
absolutely,
you are an incredible wealth of information. Time I interview you, I am just like, thank you. And I know our viewers have been chiming in and saying the same. There's so many questions, and you've answered them so thoroughly, and we're just grateful for you. We can't wait to hear when you get the vaccine, and I'm sure.
I know. Well, thank you so much for having me. This is so much fun. I'm always happy to answer questions.
It's been great. And you take care, stay healthy, and thank you for everything that you do.
You too.
Bye.